Continuing our series on hormones. Dr. Raquel is here with us today. We are talking about estrogen, which people often get very confused, Dr. Raquel. Their lab report back and they see estradiol.
Yes. Yes. And this is a common misconception too, because when you go in for your fertility cycle, whether it be IVF, IUI, whatever fertility cycle you're doing, a lot of people go in and they're like, are you testing my estrogen or my estradiol? So it's very important to know that estradiol is E2. You have three forms of estrogen that are prominent in your body, and E2 is what's tested for your reproductive health. And that is because it's produced by your ovaries in correlation with your menstrual cycle every month. So this number varies due to your menstrual cycles, which is why your fertility doctor will test it.
Interesting. So what's E1 and E3 for?
Yes. So E1, I know, so confusing. So E1 is going to be estrone. So estrone is produced by another sex hormone we have called androgens. So these produce E1 or estrone, and it's produced primarily in your fat cells and in your muscles. And then the last one is going to be E3, and they call this the estrogen of pregnancy. So when you're pregnant, what will show up on your blood work will be E3, which is estriol.
Right. So when people are storing estrogen in their fat, they're actually storing E1.
Primarily E1.
Okay, got it. Which can be an overall endocrine disruptor if they're storing it right. Right, got it. Okay, and that's for both men and women. I think that's important to note, right? Men and we both make estrogen.
Yes, and that's what happens a lot, especially in men that use marijuana excessively. They start to go through a process that's called aromatization, and that's what transitions their androgens or testosterone into estrogen, and they produce like breasts and things like that. So you want to make sure that we are understanding like estrogen is very important for our reproductive health. It's even important for us becoming women. So in puberty, it helps us to produce our vagina, our uterus, our breasts, our pubic hair, our underarm hair. Estrogen is responsible for all of that. So we need it, but we never need it in excess. And that's what happens a lot in endocrine disruptors.
Okay, got it. So E2 is really the marker, is a really important fertility marker to understand that you're functioning the way that you're meant to. Do they ever look at the ratio of E2 to E1, or does that not matter? Well, that's in the way. When do we look at it?
Right. So E2 is going to be most important. So E1 is also produced. It's a very one that's produced prominently as well. But when we are going through our cycle, because remember, when you're going through your fertility cycle, it's looking at what is happening when you're developing that follicle that you need to ovulate and meet with the sperm. So when it's looking at that test, it's looking at E2 at the beginning of your cycle.
Got it. Now, there's a lot of, I mean, we've talked about this before on the show. There's a lot of endocrine disruptors in general out there. Are they disrupting E2? Or are they disrupting E1?
So what happens is, this is really cool test called the Dutch hormone test. And it actually breaks down these estrogens, and it shows how our body can overproduce one over the other. And unfortunately, what happens in a lot of women and men is that our body does not have the mechanism to clear that pathway of estrogen, because our bodies are intelligent. It knows like, I need to get rid of this estrogen, right? But if you're overproducing or you're exposed to chemicals, you're exposed to pesticides and plastics, your body is producing so much that it can't clear it. So whenever we're thinking about like overproducing, it could be either of the estrogen receptors. The only one that is relatively weak is going to be E3. So even when you're not pregnant, E3 is present in your body in very small amounts.
Okay, got it. Now, when it comes to the E2, when you're going through an infertility cycle and you're taking hormones to mimic your cycle, to trick your ovaries into ovulating more than one egg at a time, at what point are you starting to actually add estrogen?
So that's going to vary based on your cycle. So I definitely know like Dr. Chen or Dr. Naj, doctors like that can definitely tell you more specifically when they give what they call estrase. And the reason why, I'm so glad you asked that question. The reason why is because estrogen is very important for thickening your uterine lining.
Got it.
So they oftentimes give estrase to get your uterine lining really thick and juicy so that embryo can implant when it's time.
Now, when women are underweight, they often lose their period. So when women are underweight, right? So if they're anorexic or just underweight because of sports activity where they don't have very much fat and their BMI is super, super low, and they can lose a period, is it that E2 or the E1 that's like causing them to lose a period, not have a thick lining and not have it shed every month?
Right. So that's going to be your estrogen as a whole. When it's looking at your cycle, of course, it's testing E2, but that's going to be your estrogen that's helping your uterine lining to get thick. They're just looking at that marker to see how that follicle is growing at the beginning of your cycle. But that's so important because we see that a lot, actually. We see a lot of women that are very underweight or anorexic, or sometimes women that are vegan that don't know the right foods to eat. Their bodies are undernourished. So I always ask my patients, like, are you vegan because of, lifestyle or health problems or morals? Why are you vegan? Because sometimes your body does need to be nourished with the right proteins and especially fats. And that's what I feel like is missing a lot in vegan diets that we see.
Got it. Okay. Now, if I understand it correctly too, then when you're thinking about estrogen, and as some women who are in premature ovarian failure, their estrogen is going to be really low because they don't have that their ovaries are not producing that E2, correct?
Exactly.
As we head into menopause, we can expect our estrogen to be really low as well.
Right. And that's why a lot of women do hormone replacement therapy and they try to take estrogen, because a lot of women that stop producing the right amount of estrogen, they start to experience like the hot flashes and the vaginal dryness. And it's because literally your uterine lining and the tissue of your vagina start to atrophy when you start to lose that estrogen. So.
Got it. Okay. Yeah. I was kept in medical menopause for 3 years during my cancer treatment, and I remember not so fondly some of those issues arising. Yeah, wow. It was an intense time, and I remember because I kept all of my hormones, bottomed out at 0 pretty much, and it was a tricky time for sure. So I empathize with those women who are perimenopausal or menopausal, and a lot of times in the IVF setting, we're stimming women who are already perimenopausal, or women who have experienced premature ovarian failure, and they're not producing these hormones, so they're kind of already coming to the table, right, with some of those side effects that are making even sexual wellness difficult.
So
when it comes to kind of that classification of people, I mean, there are creams and all kinds of things, right, that women can try. What are like the different types of solutions that if a woman outside of fertility, but just from the sexual wellness or perimenopausal, menopausal state, do? Is it injections? Is it a patch? Is it creams? What are the variety of solutions for estrogen replacement therapy?
I know. So these days, I'm never amazed by what I hear. Like, I had no idea that people were taking supplements through a patch. I was like, wait, she's like, oh, I have B12, but it's like a patch. And I was like, whoa.
Oh, I didn't know that.
Yeah, I was blown away. But yes, so today, estrogen is in so many different types of solutions. What I always recommend, however, some people even inject them into the body, like in a pellet, which to me can be a little tricky because what if too much is released? What I like are the solutions that allow you to apply these estrogens near fat sources in your body, like your abdomen or your thigh and things like that, because to me, it's going to the right place so your body can use the estrogen effectively.
Oh, I see. Okay, that makes a lot of sense. All right, I feel like I could ask another 100 questions about estrogen alone or estradiol or E2. So I think the bottom line of Fertility Tip Tuesday is it's your E2 that they're really looking at when you're approaching a fertility cycle and when you're about to start your stimulation. Your E1 is stored in your fat, and that, as always, stay away from plastics.
Stay away from plastics. It's going to make you overproduce. So yes, all your plastics and pesticides, stay away.
All right, perfect. Well, thanks, Dr. Raquel. As always, next week we're doing FSH, so don't miss it. This is your Fertility Tip Tuesday with Alice and Dr. Raquel. We'll see you next week.
Bye now.